Dr. Philip Yu. I'm the director of the Laser Med Institute, and today we have our famous patient, Ed Califf. He's the box king, and he just got done a few days ago with a bunion surgery of the calcaneus. So they incised the Achilles tendon, bisected that, and also his this lateral fifth metatarsal had a bunion there, and they kind of shaved that off. So today, it's been a few days after the surgery, we were able to get the cast off, and now what we're going to do is we're doing some class 4 laser therapy in order to stimulate healing of the tissue. And what this laser is doing, it's penetrating the area where he had the surgery to increase circulation. He still has some edema and swelling and bruising, and this is going to increase his circulation and healing processes by multiple fold. And the red part of the laser you're seeing is just the aiming beam. It's not the healing part of the photonic energy. It's actually invisible, but you can see we're painting the area of where the stitches are, the incision was, and that's going to increase ATP formation. That's going to be absorbed by the mitochondria in the tissue to increase DNA, RNA expression, increase metabolism, drain all the waste products, lactic acid, cytokines, to decrease inflammation, and flush out all the waste products and toxins, and bring in blood for healing, oxygen, glucose. It's also going to cause increase of nitric oxide production, which will vasodilate the vasculature, which will also increase the blood flow and healing factors. So, what else I'm going to do is I'm going to cause more drainage of all this edema, and we're going to manually kind of encourage the vascular system to drain all this dead blood and fluid out. And the way I do that is we're going to use these myofascial release stainless steel tools. It's called the laser edge technique, which I've developed. It has a nice masking grip, so your hands don't slide. All right, and what we're going to do here is I'm going to literally just milk out all this edema very gently. And whenever, of course, you have surgery, you're going to have fibrosis forming, and that happens fast, within 48 hours. And the longer these fibers are able to bind, the more scar tissue adhesions which form, and that's why it takes a lot of rehabilitation to get the range of motion back. In this case, we want as much dorsiflexion, otherwise he won't have a good gait. The natural gait is the heel strike, mid stance, and then toe off. But if he doesn't have enough dorsiflexion because of the surgical scars and not be able to move it for weeks or several days, he's going to lose that normal gait mechanism, and then probably these bunions and spurs will start coming back again because of the faulty biomechanics. So we want to restore as much normal dorsiflexion as we can in the foot, and then get him with Dr. Kovsky. He's the medical director of the U.S. track and field team, to cast a custom orthotic for his foot, so he has normal biomechanics, prevent this from happening again. Okay, so Ari, could you have someone restart this right here?